Developed during the first half of the 20th century, behavior therapy is based on three types of paradigms: operant conditioning, classical conditioning, and modeling. Originally viewed as a scientific, reductionistic, and mostly sterile approach to counseling, today's behavior therapist realizes the importance of having a strong therapeutic relationship. For instance, it is now usual for the modern-day therapist to use empathy and develop a collaborative working relationship with the client. This allows the therapist to build trust and correctly identify targeted behaviors the client would like to change. After behaviors are identified, goals can be established and techniques chosen. Today's behavior therapists usually have a wide range of techniques to choose from, with some of the more popular ones being modeling, such as when clients observe behaviors, usually in the clinical setting, and later practice the behaviors in the office and on their own. Assertiveness training has been particularly used in this fashion. Operant conditioning techniques, such as positively reinforcing targeted behaviors and extinguishing unwanted behaviors, such as the use of sticker charts for children. Relaxation exercises, such as learning how to progressively relax oneself in an effort to reduce anxiety or other unwanted feelings. Systematic desensitization, which is often used with anxiety disorders, is the deliberate pairing of collaboratively chosen hierarchical aspects of the feared object with learned relaxation techniques, thus slowly reducing the fear response. Flooding and implosion techniques both involve the exposure to intensive amounts of fearful stimuli, with the assumption being that prolonged exposure will extinguish the fear response. And self-management techniques, which are used when one wants to help clients learn various behavioral techniques and have them practice on their own. In the following role play, Dr. Susan Thompson works with Rainier, who is struggling with a panic disorder resulting from a recent car accident. Dr. Thompson will assist Rainier in applying relaxation techniques to her anxiety about driving.
Hi Rainier, welcome back.
Hi Susan, how are you?
I'm doing okay. So how has the practicing been going with the relaxation techniques that we talked about last time?
Well, it was kind of hard at first. I just kept having my heart palpitations and the sweating, and then I put little hearts up around the house, and every time I saw a heart, it helped me remember to do the breathing you taught me.
What a great idea, sort of that association.
Well, I really needed it, because if I didn't see something outside of me, I just kept being involved in the feeling.
Right. Right. And so that reminded you to bring up that relaxation that we talked about. Okay. Well, so one of the things that we're going to do today is to talk about the different components of what's happened for you, and use the relaxation along with sort of a hierarchy of events or situations that you might face. And eventually what we'll do is have you practice the relaxation along with each of the different pieces of it. Does that make sense?
It does. And that'll be good, because it's been really hard just getting in the passenger side of the car, and somebody else has had to drive me.
Yeah, I was wondering about that.
And just getting in the car, it makes me very nervous, and I start to sweat and tremble and feel a little shortness of breath. And I'm real concerned that I won't be able to go back to work, and because I drive for a living. If I'm not driving, then I can't make do for my family.
So we really kind of have some short-term, immediate kinds of things that you want to focus on, getting in the car even, and then maybe some longer term that would be getting you back to work. Is that?
Yes.
Okay. You said that you had some of the anxiety came up when you were even getting into the passenger side coming here.
Yes.
Okay.
Yeah, I felt a little like I was choking, and I just had this loss of control that if I was in the car again, something else would happen.
Yeah.
And when this accident happened, I didn't have any passengers, and I keep thinking if it happened again, or what if there were passengers and somebody else was injured.
Right.
So it's very
Okay.
scary.
Yeah, it sounds like it was. Well, if we had to kind of break things down, because that's what you're telling me now of what's going on now, and if we had to break things down into smaller pieces, let's look at what those pieces might be.
Okay.
And I'm going to write some things down so that we
Sure.
can kind of keep things straight. So one of the things that you're having a hard time with is that even getting into the passenger side. But maybe we can back up from there.
Okay.
So as you think about even getting into a car, what happens to your anxiety?
It goes up. It's
Okay.
I'd say just thinking about getting in the car, it goes up to, on a scale of 1 to 10, it goes to like a 5.
Okay.
And maybe a 4. It's like it gets to a 5 when I get ready to get in the car.
Okay.
But I start the heart palpitations, and I'm sweating, and I start to tremble a little bit, and I just have that fear that, I'm going to lose control or something's going to happen.
Yeah. So even just that's that thinking about it. And I'm glad that you went ahead and put that scale to it. We talked about that last time as a application here. So thinking about getting into the car is about a 4 or 5, depending on.
Well, probably is. I just get to me, it's not just thinking about you get in the car. So I guess thinking about it is a 3, but actually
Okay.
getting in the car is probably a 5.
And is that getting into the passenger side or the driver's side?
Well, I'm getting into the passenger side. I've been too afraid to get into the passenger side.
Okay.
So the passenger side is definitely a 5, and the driver's side is higher.
Okay. So where would you rate the getting into the driver's side?
It's definitely at least a 7.
Okay. And I'm wondering if there's something in between there, getting into the driver's side, or what's surrounding that?
Opening the door.
Okay.
And once I got into the driver's side, and then usually then I kind of put my hands on the wheel, and sometimes then I start the car after I check the mirrors and put on my seatbelt and stuff.
Okay. All right. So you're doing a great job of starting to break things down. That's exactly where we're headed with this. So just so that I have it straight, it's thinking about getting into the car even before you go anywhere, even before you leave the house. Is about a 3, so that brings up
Yes.
some of the anxiety. And then getting into the passenger side is a little bit higher. Opening the door to the driver's side is a little bit higher than that, but not as high as, say, getting into the driver's side.
Right.
Okay. And then putting your hands on the wheel kind of brings it up a little bit more. And then starting the car is a little bit more too.
Yes, it feels like
Okay.
it would be. I haven't tried it yet because I've been too anxious about it.
And that makes sense. Okay, so starting the car, and then if we take it one step further, what would be another step from there?
I guess maybe driving the car like a
Okay.
short distance, or
Yeah,
maybe
really
in the
short
driveway
distance.
or something.
A really short distance. So
That
in the
might work.
driveway. Okay. And then what would be a next step from there that we could aim for?
I guess going around the block.
Okay. All right. And if you had to thinking about that right now,
That feels like it's a 9.
okay. Okay.
Yeah, I'd start sweating all over again just thinking about driving and going around the block, because I know there'll be other cars out there, and that really is scary for me.
And I see that in your face. Okay. So then we have sort of a hierarchy of different pieces of getting back to driving that we can then apply the relaxation techniques. Okay? So let's just do one right now, just for practice, and see how that goes.
Okay.
Right? That first one that you have on the list is just thinking about getting into a vehicle.
Okay.
So right now, as you're thinking about getting into a vehicle, I see that you're kind of shaking. Remember the relaxation. Talk me through the relaxation that you're aware of.
trying to take a deep breath and
Good.
and holding it for the count of 5, and then breathing out again.
Okay, so you're going to do that. Good. Just independently. Just be in that relaxed place. Great. And now, as you're in that relaxed place, think about leaving your house and getting into a vehicle, passenger side. And go back to that relaxed, take a deep breath, and go back to that relaxed place. And how is that?
Well, it's, the thinking about getting in the car is kind of scary, but I know I could put a heart in the car. I have hearts on the car, so I know to breathe when I see them, like
Okay.
I have them in the house.
Great idea. Great idea. So even right now, as you think about getting into a car, you can where would that heart be?
I would, right now, need to put it on the door.
Right on the door.
Or the window. Mhm.
Okay. I almost thought of putting it slap big huge heart on the car,
Well,
but
I don't- yeah.
it's your image. So
I have to feel better with a little one.
okay.
Just a little one.
Okay. So let's go back to the deep breath. Get to a relaxed place. Good. And as you're in that relaxed place, think about just going out to the car. The heart's right on the car, exactly where you put it. And keep relaxing. That's it. Go back to the
I feel
relaxed
more like I
place.
have to do it than I'm relaxed about it.
What do you mean?
Well, if I can't drive again, then I won't be able to work again.
We're just going to take it a little bit at a time. So right now, it's that one piece of thinking about going out there. The rest of it will fade away for right now.
Neat trick. Okay, that does feel a little better.
Okay. Before, when we first started talking about that, you rated it as a 3. Where is it right now?
It's probably a 2.5.
So we brought it down a little bit. What I'm going to ask you to do then is to keep practicing that, because the more you practice it, just like you did at home, the more you practice the relaxation and with the heart, you're able to get to that place. It's the same thing with each one of these. So we're going to take it a little bit at a time, and we'll build from there. Okay?
Thank you. I appreciate your help.
Sure.
Well, Susan, that was great, and I really appreciate your work with Rainier.
Thank you.
I particularly noticed how encouraging and how empathic and how warm you were with her.
Yeah, I know that for behavioral counseling, people have this impression that it's
Right.
cold and it's sterile, but any counseling, really, you have to work on the relationship, and that
Right.
rapport building and empathy and encouragement is a big part of any kind of counseling, and it's particularly applicable to the behavioral.
Right. It seems like when I've been doing my post-interviews with the different therapists doing the role plays, that I think all of them have been saying that how important the relationship is with the clients.
Yeah.
Why did you choose the particular techniques that you chose with this client?
Well, she came in with some problems with anxiety, and there was a clear incident, something that's very specific that happened.
Right.
And that lends itself very readily to the behavioral approach.
Okay. And then the idea of using relaxation techniques and systematic desensitization.
It's very, very clear, I think, in terms of working with anxiety. That is, it just is so helpful
Right.
to break down the different pieces, because people tend to take the whole situation,
Right.
and the systematic desensitization really breaks things down into little parts
Right.
that are much more manageable for people.
I see. I noticed that you really worked collaboratively with her, and that you were really letting her take the lead in some cases. What are your thoughts on that?
That, I think, that has the investment of the client in the process.
Okay.
So that, again, it's like that. It's like to building the rapport. It's having a collaborative relationship, I think, that makes a big difference in the behavioral approach working.
Right. As you were building the hierarchy with her, I was thinking about the fact that many of these things on our hierarchy she can only do outside of the office.
Yeah.
And I was wondering if you were going to physically go outside the office with her, or do you tend to stay in your office and have her do it?
It really depends. It depends on a lot of different things. I start in the office, and we start with thinking about the different situations,
Right.
and it depends on what she might run into as a problem. And if she
Okay.
runs into it as a problem, then we figure out ways that either she can get help with it, or she might need my help with it.
Okay, so let me see if I'm hearing this right. If you're thinking that if she can maybe do this on her own, that she can, but you're willing to kind of go, willing and able to go out there and be with her if
Yeah.
she needs it.
Yeah, I am.
Okay.
Yeah, brain research these days says that we make no distinction between what we imagine and what we actually do.
Okay.
So,
That's interesting.
so to me, that's an exciting piece to making this behavioral therapy work.
Right, right. That's very interesting. Yeah. Well, I want to thank you so much for your expert work with Rainier, and I appreciate you being willing to share that with us today.
Thanks.